Hi, and for the next couple minutes, we're going to talk about why prescription drugs taken correctly are the fourth leading cause of death in America. Hi, my name is Dave Brubaker, and in 2013, I had 4 stents implanted around my heart, and I was given a drug called Plavix to prevent blood clots from forming in the stent, and then I was sent home. The next day, I had a blood clot-induced heart attack. A blood clot formed in the stent. My wife called 911. I was rushed back to the hospital in an ambulance, and it was a very scary situation. 2 years later, a simple DNA test that was covered by Medicare revealed Plavix doesn't work on me. Had my doctor only known that, I could have avoided a heart attack, which damages heart muscle. So why didn't my cardiologist test me before surgery is a question that lingered on my mind. Folks, prescription drugs taken correctly are responsible for 700,000 emergency room visits, 2 million hospitalizations each year, 127,000 deaths annually. I think that's 347 a day die from taking their prescription drugs correctly. 11 or more medications increase your risk of having an adverse event by 98%. We're going to talk about something that resulted from the Human Genome Project. This is good news, but between 1990 and 2003, the US government spent $3 billion to sequence 3.2 billion DNA pairs. It turned out to be about $1 a pair. That's enough of information to fill 1.6 million books. And they discovered something called the SNP, or the SNP, stands for single nucleotide polymorphism. Now, this presentation is going to be rather simple, but this little slide right here, you need to put your thinking cap on. The DNA strand is made up of 4 nucleotides: adenine, cytosine, thymine, and guanine. You're familiar with this little curlicue DNA strip. As the DNA duplicates itself, it's duplicating these nucleotide pairs. So this pair is the adenine and the thymine. And 1 out of every 100 pairs do not duplicate perfectly. So the AT, as you can see, duplicated perfectly, became another AT. And on the right side, the CG duplicated perfectly, became another CG. But in the middle, we have a CG that duplicated as a TA. It's a mistake, and that's what they call a polymorphism. We call these the SNPs. So our SNPs are what make us different. That's why some of us have light skin and straight hair, others have dark skin and curly hair. Some of us metabolize drugs slowly, others metabolize drugs rapidly. A drug that works well for one person may not work for another. So to approach drugs with a one-size-fits-all doesn't work. Our body metabolizes 80% of drugs in the liver. And the liver's primary mechanism for metabolizing drugs is a group of enzymes called cytochrome P450. It's called the cytochrome P450 family of enzymes. They have strange names. One enzyme is called CYP2D6, another one's called CYP2C19, or the VKORC1, and so on. As people age, their enzyme activity decreases, and older people cannot metabolize drugs as well as younger adults. So we all metabolize drugs differently. Some of us metabolize a drug poorly. That means that the active drug accumulates in our system, and we're at risk of toxicity. This person requires a lower dose or a different drug. There's intermediate metabolizers. That's somewhere between poor and normal. They require a lower dose or a different drug. Extensive metabolizers, that's just another word for normal. And then there are certain that metabolize their drugs rapidly. They use them up in as little as 30 minutes. There's no drug left in the body. These people require a higher dose or a different drug. And the question you need to ask yourself is, which one am I? Do I metabolize drugs poorly, extensively, rapidly, intermediately? Well, that's what I found out. And that's what alerted me to why I had a heart attack in 2013. Out of 100 patients in a doctor's waiting room, 46 are normal, 35 are intermediate, 13 are poor, and 6 are rapid. So, which one are you? If you're in the intermediate, poor, and rapid category, you cannot take drugs just off, just as prescribed. You've got to have them adjusted. There's an organization called the Personalized Medicine Coalition. They were launched in 2004 with 20 members. Now they have 193 members. It consists of hospitals, universities, laboratories, and so forth. They've got this wonderful 65-page report about personalized medicine that promotes checking out your DNA before being prescribed. We're just going to look at 4 pages, okay? So the first page, patients who do not benefit from the first drug given. 38% of people taking antidepressant drugs do not benefit from the first drug given. Asthma drugs, 40%. Diabetes, 43%. Arthritis, 50% do not benefit from the first drug given. Alzheimer's, 70%. Cancer, 75%. This is why most doctors treat with a try this for a while. If it doesn't work, we'll come back and we'll try something else. So that's based on trial and error. Not very scientific. 17,000 strokes could be prevented each year if a genetic metabolism test was used to properly dose the blood's thinner warfarin. Let me ask you something. Are you taking warfarin? If so, did you have a DNA screening done before you were prescribed that? 34% less chemotherapy would have been performed if women with breast cancer received a genetic test prior to treatment. It's estimated in 2019, 227,000 women took chemotherapy unnecessarily because a DNA screening was not done first. The third page is many variations in genes cause drugs to be metabolized faster or slower than normal. These are statements from the Personalized Medicine Coalition. Some individuals have trouble eliminating it from their bodies, leading to overdose toxicity. Others eliminate the drug too rapidly before it had a chance to work. In the last page, if these genetic variations are not considered when dosing, the consequences can range from unpleasant to fatal. In my case, a heart attack. A pharmacogenomic test, this is a test that we call the PGX test. It determines how your unique genes metabolize about 300 different drugs. It's a non-invasive cheek swab. It's a personalized report that shows which meds are safe for your DNA and which meds need to be adjusted and which meds you should avoid. Everybody should have a PGX test. It's a portable report. You can take it to all your specialists with you. You want to make sure all your doctors are singing off the same page of music, and it guarantees that you will always get the right drug at the right dose the first time, every time. Let's look at a sample copy of someone's personalized report. We're going to break drugs down into 3 categories. The report's going to show a red X with a circle around it. That means the drug is not effective and it could be toxic to your body. If the drug has a yellow caution sign, that means that the doctor needs to adjust the dosage and monitor it closely. If it's got a green check mark, it means that this is safe for the patient to take. And so we, this is many pages long, but we start by just seeing that the drugs are put into 3 different categories. And essentially, you just want to be able to avoid drugs in these 2 columns. So it makes the doctor's job a whole lot easier. You can see the whole report at pgxsample.com. The very back of the report, all the drugs that were in the yellow and red columns are itemized here and gives you instructions and warnings. For example, it's saying that the citalopram, it may not benefit this client or this patient. On the next drug, it says use a lower starting dose. On the Plavix, this is the one that cause me to have a heart attack because I don't metabolize it. It says consider an alternative. And for the clozapine, says the patient has an increased risk for weight gain if they take this. That's not normal for most people, but for this patient, it is. Our DNA shows us the future, and it allows us to change the outcomes. It lets you know how you're going to respond to a drug before you even take it. So no more trial and error. The last page has a wallet card. You can keep it in your wallet, and it basically tells your ER doctor which drugs are good for you and which drugs might harm you. Whether it's your ER doctor or maybe you're on a cruise and you're in some foreign country and you hand this then to the doctor and you know that you will be taken care of. What other people are saying, the Mayo Clinic says before taking a single dose, you can now know how you're likely to respond to a medication. The FDA says genetic testing offers new promise for predicting who will respond to a medical therapy and who won't. St. Jude's Hospital, if you knew this genetic information is available and did not act on it, you would not be practicing good medicine. So who's doing pharmacogenomic testing? It's taken many years for this to catch on, folks, and it's been out for a long time, but very few private practices are using it. But look at the hospitals: Drexel University, Duke University, St. Jude's Hospital, Cancer Treatment Centers of America, Mayo Clinic, Scripps, Stanford, so forth. Our DNA also tells us if we carry hereditary cancer genes or hereditary cardio genes. So have you or several others in your family ever had cancer? If so, you may qualify for a hereditary cancer screening covered by Medicare. You may also qualify for hereditary heart screening. So early detection screening is what this is about. If you know, traditional mammograms, colonoscopies, PAPs, biopsies, etc., they spot cancers after they've become detectable. But genetic cancer testing doesn't screen for cancer. It looks for genes we inherited from our ancestors that can lead to cancer. Discovering the gene before they may lead to cancer or other cancers gives us time to make lifestyle choices to try to prevent it. According to the Center for Disease Control and the American Heart Association, on average, 735,000 Americans have a heart attack and 610,000 people die of heart disease yearly. It's the number one killer of humans, is heart disease. Every 40 seconds, someone has a heart attack. Cardiovascular disease claims the life of a woman about every 80 seconds. But the good news is 80% of cardiovascular disease is preventable with education and action. So you may ask, well, why should I take a cardiac heart assessment test? The heart is a very complex muscular organ that pumps oxygen and nutrients throughout the body and also rids the body of toxic substances. There are many different types of heart disease that can be passed from generation to generation. And if you have heart-related issues, this simple test can identify if you or those you love have an increased risk for heart disease. So you may question, why is Medicare doing this? Why are they covering all these tests? Well, in an attempt to cut down on $74 billion spent each year on cancer alone, in March 2018, the Center for Medicare and Medicaid Services, CMS, announced their decision to pay for DNA screening for seniors who have or had cancer. Medicare also now pays for DNA screening for all those who have heart disease, dementia, Parkinson's, and Alzheimer's. So how do I qualify? Well, we can't really qualify you. A medical doctor has to do that, but you can sort of pre-qualify. If you're taking 2 or more meds for 2 or more conditions, you may pre-qualify for a PGX test. If you're taking meds for heart, diabetes, cholesterol, high blood pressure, muscular dystrophy, you might qualify for the cardio test. If you've been diagnosed with Parkinson's, Alzheimer's, and dementia, you qualify for the PAD test. And the CGX, that's cancer, if you or a relative had cancer, you and a relative, you would qualify for that. but the doctor needs to make that final decision. But if you brothers, sisters, parents, aunts, uncles, nieces, nephews, here's the DNA screening process. If you qualify, we collect medical history first and then submit that to a licensed physician who evaluates you by phone and orders the reports. The physician is looking for medical necessity. Medicare requires medical necessity, and only a doctor can determine that. We collect some DNA and signatures, and then we overnight them to the lab. The lab receives the swabs and extracts your DNA, and then the lab creates clear, actionable reports and sends them to the physician who you spoke with, who evaluated you by phone to see if you qualified. Then you can discuss the results with your family doctor, your primary physician, or your specialist, and adjust your medications. So the question people ask is, well, how is genetic testing regulated? Well, US labs performing genetic testing are regulated under CLIA. That's the Clinical Laboratory Improvement Amendments Act, required to meet federal standards of quality, accuracy, and reliability. The lab that we are working with, Dyax Laboratory, is CLIA certified, and they're located in Tomball, Texas. This is a picture actually inside of CLIA Labs. So I'm sorry, Dyax Labs. Also, the Genetic Info Privacy Act of 2008, called GINA, it ensures that health insurers may not use genetic information to make eligibility, underwriting, or premium setting decisions. As defined by the Department of Health and Human Services, medical information regarding individuals and family members' genetic tests must be kept private. How much does it cost? Well, if you have Medicare Part B or a Medicare Advantage PPO, it costs nothing. On your Medicare card, you see Medicare Part B, that covers the medical. And in this case, it covers the PGX, the CGX, the cardio, and the PAD, should you qualify for those. So lastly, I want you to be aware of Medicare scams. To stop thieves from taking advantage of seniors, Medicare has very strict guidelines we must follow. And so I wanted you to be aware of how to spot a scammer. If you get a telephone call from a stranger about a free genetic test paid for by Medicare, it's a scam. Stay away. If that person cannot show you their HIPAA certificate, that means they're not certified. That's Health Information Portability Accountability Act. And then if the testing does not involve a physician, again, it's a scam. And fourthly, if they offer you a gift to participate, they offer you a gift card or something to participate, it's a scam. That is illegal, and the person doing that, if we could catch them, we'll go to jail. So just want to be aware. We want to protect our wonderful system, and we don't want you to be taken advantage of. No, we do make house calls, and we would be happy to do this face-to-face, but under the circumstances, if you're uncomfortable with that, we can also do this over the phone. So get back to the person who referred you to this presentation, and we look forward to helping you.